Most dentists aren't trained to run businesses, let alone scale them. This is the TechDental Podcast for dental leaders who want more than just tips. We give you systems, strategies, and straight answers. I'm Dr. Randeep, and each week I sit down with the operators, AI founders, entrepreneurs, and business leaders who are reshaping what's possible in dentistry. If you want a smarter, scalable, future-proof practice, then this is the podcast for you. Today's guest is one of the most influential leaders in the dental industry. With a career that spans senior leadership roles in finance and insurance, he now leads Bupa Dental Care across its network of nearly 400 practices, a champion of progressive leadership and change in the corporate dentistry model. He has led Bupa through major operational restructures, driving commercial transformation, and navigated the most difficult of market conditions. He brings a rare combination of commercial discipline, policy insight, and purpose-driven leadership that aligns strongly with the future of a more intelligent, human-centered model of corporate dentistry. Our guest today is none other than Mark Allan.
Hi, Randeep. Great to be here. Thanks for having me on.
I've really been looking forward to this conversation for some time. There's been a lot of work behind the scenes, but we're finally here and our listeners are in for a treat. There's a lot to unpack today, from technology at scale to patient experience, workforce transformation, and the future of the profession in a technologically disruptive environment. So let's dive in. Technology at scale is where I want to begin. You came into dentistry after a career at RSA Insurance, where you led operational and commercial teams that give you a unique vantage point on how to introduce technology into a complex, distributed organization. What do you think people often get wrong about introducing new technology in a large organization like Bupa Dental Care?
You've gone straight for the jugular there with the first question, Randy. We're straight in at the deep end. I think there's probably a couple of things I would say. I think one of the things is people often jump straight to seeing a piece of technology and then deciding that they want to implement the piece of technology, rather than maybe just standing back and asking yourself, what problem are you trying to solve and whether technology can help you with that. So often, if you're not careful, then you could end up implementing a square peg when really you needed a round peg for the round hole, if that makes sense. I think the other thing that I've really learned a lot of and about over the last 3 years, which was my first foray into healthcare provision and the world of dentistry, is the complexity of trying to implement technology at scale in a dispersed network. My background was largely financial services, with a small dalliance in estate agency for a while, which had some similarities actually to dentistry, with it being branches and local places. But when you're running a business where you've got maybe just people working at home or people working in call centers, and you want to roll out a piece of technology, and also they all work for you, they are on your payroll, they are your employees, you can be quite clear about what you expect and you can roll out probably at pace and at scale. Not easily, but it's certainly easier than trying to roll out technology into an organization that's in 380 different places, lots of small businesses, self-employed clinicians that you need to influence to do things your way, and you can't necessarily mandate that you want those things to happen. NHS business, private business, specialist referral sites. I think it's certainly made me be a lot more thoughtful about all the things and all the planning you need to consider and the risks that you need to work through before you just race ahead and implement a piece of kit.
And building on that, one of the hardest things in a large network is balancing consistency with the flexibility. Standardization is essential for quality and safety, but practices also have very different patient demographics, staffing models, and local realities. How do you strike that balance between a unified digital experience and the day-to-day realities of hundreds of individual practice environments?
Yeah, and another great question, and one of the great challenges, I think, of running a really big dental network. I think that there are some things where standardization is critical. So if I think about the organization of your data, if I think about data security, then you do need to make sure that there are minimum standards that everyone adheres to. And you can't just decide to loosen the data security standards in a practice because you think they might want a bit more flexibility. There is a minimum standard, and that needs to go across the board. How you apply the technology, though, and the flexibility that you give, especially in a business like ours, is really key. I'm always quite envious when I talk to some of the smaller groups that are growing, squat practices growing, where they're able to be very clear about this is our way. And if you work for us, you follow this patient flow and we want you to use this piece of kit. I think if I was in their shoes, I would do exactly the same thing. The challenge for us is we're an inherited business that's grown through acquisition. And there are lots of people who've worked for us for a number of years or worked for the business before it became acquired by Bupa. And if we were to go wading in and say it's one size fits all and our way, we would very quickly, I think, have a lot of difficulty commercially. And we probably wouldn't be that attractive a place to work. So for me, it's all about really understanding those local businesses and trying really hard to get into adult to adult grown-up conversations where we understand each other's perspective and find the smartest way forward. But undoubtedly, there are compromises and flexibility that we need to build in.
And what I'm seeing across the industry is that the future is not just about adding tools, it's about redesigning the patient journey around those tools. Digital patient journeys and data connectivity are becoming the backbone of modern care. When they work well, clinicians get more time with patients and administrative load is also reduced. How are those digital connections helping your clinicians spend more time with their patients?
It's an interesting world, isn't it, where you didn't know you needed something until the technology pops up and shows you that you can do things you didn't imagine. It was true with the iPhone however many years ago, but it's true now with a lot of the new AI tools that we see cropping up on Instagram, solving a problem where you didn't even realize you had a problem, but then you need to embrace those keenly. I think we, like every other business, are at a relatively early stage in this digital adoption world. Obviously, there's many more established digital tools in practice, like an intraoral scanner. But the two pilots that spring to mind that we've got underway at the moment, one is around clinician note-taking and one is around AI diagnostics on x-rays. And we're really careful, thoughtful in how we roll those out. But if I take clinician note-taking, we've actually built our own tool at the moment. That's where we're at because we wanted control of that. We wanted to be able to iterate that at our pace. And there are lots of different potential benefits, I think, of a tool like that, ranging from probably quite a short-sighted view that if you speed up note-taking, then you can cram another appointment in the day. And if that's the only benefits case you're looking for, then I'm not sure that's the richest benefits case. But probably more likely by just taking time out of that admin, that drudgery of writing things up. And we're seeing about a 50% reduction in note-taking time. We are creating space. And that space can be used in a multitude of ways. It could be used to put another appointment in the diary, but it could also be used to spend much more time with the patient, explaining the care, opening up patient finance, opening up new pathways for that patient, and also at the end of the day, giving a really much better work-life balance. Because we also know from the work we've done that a lot of our clinicians are spending time in the evening catching up with their notes. That's what's exciting about a piece of technology like that. The other thing, obviously, with clinician note-taking, and it's why we've taken at this stage the decision to build something, is the potential it creates through the organization of the data, rather than just random notes that someone can read if they ever pick up that patient's file. The fact that the data is now structured and we can now start to make connections with that data and add that to all the structured fields, that's huge for an organization like ours.
Yeah, I think the point on data structure and data hygiene is a really important one because a lot of these tools, they tend not to work if the underlying architecture is not going to be useful for the tool or the AI to ingest. Let's move a little bit more into how data and AI are reshaping what's possible. One of the biggest themes we explore on this podcast is the shift from digital tools to intelligent systems. So from using technology to actually unlocking insights and impact. From your position, where do you think AI will have the fastest and most measurable effect on dentistry? And where do you think it really will take much longer to deliver?
We're already seeing a number of AI benefits, and we can see it in the pilot reduction in time on admin. So that is of huge benefit to the clinician and potentially beneficial to the patient if that time is used in the direction of the patient. The X-ray diagnostic pilot we've got going on is suddenly engaging the patient in the education of what's going on in their mouth, whereas we've all sat there in the dentist chair and been shown a black and white image and not really had a clue what on earth that the dentist was saying to us. So I think that engagement is here right now and moving quickly. There are also clearly coming out of the traps a number of kind of companion tools. That's perhaps the best way of describing it. So things that people can sit alongside them in their role to help them be better at what they do. I'm now using ChatGPT on a regular basis as my buddy that comes around with me. And when I'm not sure what to do, or I need some information on something before I would have had to go and ask someone, now I can quickly get a decent answer on that. But treatment coordinators, receptionists, all of those tools that I think they will deliver quite quick benefit and quick commercial benefit. But where the bigger long-term game is, though, is in the connection of all those things. And I think we all have to be careful not to run after the next piece of technology and want to get it implemented because it's got a big prize against it. Only to find we've ended up with 7 cul-de-sacs in our estate and none of it talks to each other. And certainly for us at Bupa, being part of a big healthcare organization, multidiscipline healthcare organization, the potential of the data that comes out of some of these tools is huge. I was telling someone the other day, in the last 6 months or so, I've used my private medical insurance. I've had a dentist appointment, a hygienist appointment, up into the Cromwell Hospital to see a consultant. I've had a health assessment and I've had a full genome test. And Bupa is now in possession of that information on me. Now, at the moment, we couldn't join all that up and draw many insights from it. We can do it with some manual intervention. But our organization is going strongly in that direction about trying to piece that together and then get real actionable insights that can lead us to personalized healthcare and joining the dots between the mouth and the body. So that is the data where the real end game is rather than the tool.
Yeah, I think you're spot on there. The data and the consolidation is the place to be. And it's quite exciting in Bupa. As you mentioned, you have lots of different data points on the whole health of the body, not just the mouth. So that's quite an interesting development pathway for future. And let's move a little bit more now to workforce capability and culture. The Bupa Clinical Training Academy is a serious investment in the future of the profession. It feels like a long-term bet on skills, confidence, and standards. What led to the creation of the Clinical Training Academy and what impact is it having so far?
Yeah, it's been a really bold move, but one that I think has been received in the industry. I think it's probably one of the proof points about why we're a different kind of organization to some of our other big groups that we work alongside. As a provident association, we have no shareholders, so Bupa's excess profit is reinvested back into our purpose and back into the business. So I guess we feel we have a responsibility to support clinical development, clinical training, and really helping people develop, particularly things like nurse skills and specific clinicians. We made the decision about 18 months ago that we would create this training center. I don't think at that stage we really knew exactly what it was going to look like, but it was a joint venture between ourselves, our care services business, and our health services business, so our hospitals and health centers. And fortunately, we had clinicians designing what was in there. So if you saw the dental wing, that's been largely developed or heavily influenced by Anusha Patel, who's our head of learning and development. She's done a great job of having real attention to detail on that. And as we speak, that academy is filling up with training courses. It's filling up with people wanting to be there and attend courses there. But it's part of something bigger as well. So I think you've been there. You came to a launch event. And so the facility itself is exciting, but what people often miss as well is there are 3 of those globally. There's one in Melbourne, there's one in Madrid. We are starting to connect the dots between those. So our most recent CPD event that we did had clinicians from Australia joining and training people in the UK. And our digital learning solutions, which forms part of the overarching kind of digital campus, which sits above the physical training facility, it is now developing courses way more than you would believe. I think about 2 years ago, we did about 4 training courses. We've now done 70. This year, I think we had about 1,000 people on our most recent CPD event. And we know that clinical development and clinical progression is one of the key things that clinical professionals look for when they're looking for who they should work with, whether you be an employed nurse or whether you be a dentist, hygienist, therapist. You want to progress your career. It's been a really good move for us. I think it's going to help us with clinician attraction for sure. But we're also trying to make sure that it's a facility that's quite open, and we're really open to working with other businesses to use the capability that we've built there. Yeah, it's exciting. There's nothing finer than just jumping in my car and going and hanging out there as an alternative to being in a practice and just seeing what was there. I was there on Friday doing some stuff there. So it's a great facility.
Was there at the opening event, and lots of exciting tech there, from virtual reality rooms and VR headsets and very real mannequins, both medical and dental. So that was quite impressive.
They give me nightmares still, both the phantom heads and the dummies. You can physically have a conversation with sat there in a Cromwell hospital bed. Yeah, it's a little bit out there, but again, a brilliant training aid that's helping us develop our clinical talent.
It was very real. Yeah, very real. And some of the mannequins were very scary as well.
I think the worrying thing was, I don't know if you saw it, but in the trade press, one of the pictures was actually me over a phantom head with the equipment. Now, Neil Sicker, our director of dentistry, was right near me, but I think that's probably about as far as my own personal clinical career goes, just making out I knew what I was doing with the phantom head.
Let's move on a little bit. You mentioned the link between kind of professional development and clinicians, but what about the link between professional development and patient trust? Because that's often underestimated, but it connects directly to your Feel at Ease philosophy and the recent campaign that you had. In your view, how does ongoing professional development translate into patient confidence?
Yeah, as a non-dentistry professional, I have to be honest that going to the dentist was not somewhere that I would ever really choose to go. It's not my favorite outing and not my favorite medical appointment. So at the base core stakes, you want to know that the person who's going to be looking after you knows what they're doing. They're confident. They're going to treat you well. The nurse and the dentist understand how to work together in the pursuit of looking after you well. So it's absolutely table stakes, and all of the regulation around our industry would insist upon that. But there is no doubt there is a different experience between somebody who is at the base level of knowing what they're doing and somebody who's got confidence and wants to engage you in a conversation, take your mind maybe away from the treatment that's going on. So I think it's really important to make and to humanize those conversations and make it a less scary place to be. The Feeling at Ease campaign was off the back of a lot of research that we'd done where there was lots of evidence, if I start from a patient perspective, where quite an obvious solution that there is anxiety about going to the dentist in the first place, but it's not always just about being in the chair. The anxiety could be about trying to get an appointment. The anxiety could be about not really understanding what was going to go on when you got into the practice. The anxiety could be about, how do I pay for this afterwards? So we realized that there was a thread from a patient perspective, which if we could make everybody feel at ease, then that would be beneficial to welcome people more and make the practice a more welcoming place. And the blue fluffy chair that seems to have got some real legs has become a great image that is connecting people to it being a friendlier place. The other side of it was that we wanted clinicians to feel at ease in their career. So if you're, let's say you're a dentist, what do you want? You want a nice practice to work in. You want modern kit, stable practice team. You want an experienced nurse. You want clinical development, and you want a steady flow of patients coming through. They're the sorts of things that are going to make you feel at ease in your career, and also the opportunity to progress. And so we also followed through this feeling at ease angle about us as an employer or as a partner to our self-employed community, about making it look like a place that you can feel at ease in your career here because we will take really good care of you. And it's a welcoming environment if you were making the choice to move from another firm into our business, because we're working really hard to continue to improve those things I just talked through. So yeah, it's landed really well. And what's been really exciting for us is it's already starting to go beyond being just a marketing campaign. That feeling at ease mindset is starting to bleed into a lot of other meetings we're having here where we're talking about a different topic and someone's saying, hang on a minute, how do we bring the blue fluffy chair mindset to this and really think about that much more pervasive kind of approach of really embedding that throughout our business. So yeah, watch this space and see where we go next with the blue fluffy chair, I'd say.
Yeah, it's definitely an iconic image, the blue fluffy chair, and I don't think it's going away anytime soon. And with that, Mark, let's shift a little bit more into leadership, because it's very clear from your public work and the strategic decisions that your style is pragmatic, purpose-driven, and has long-term thinking embedded at the core. You've led large teams across several industries. What makes leading in dentistry unique?
Oh, that's a really good question. And I don't know if it's unique. I perhaps wouldn't use that word, but it's genuinely the best leadership job I've ever done. And I think it is about the people and the eclectic mix of people that you get. And there's nothing better than walking into a practice, going in, they're pleased to see you. They want to show you what they're up to. They want to tell you all the things that are not going so well. And there's a great leadership challenge in being able to really listen to that and tune in. There's a great leadership challenge of being prepared to say to people you don't agree with them, and here's why. But where you do agree with them, making sure you get follow through and action happens. And the unique, maybe not unique challenge, but certainly the more extreme challenge, I think, is the fact that we are trying to create a culture, create an environment where everyone feels engaged, connected, part of something, but we're trying to do that across 380 sites. And every practice is like a small business, and it needs to have the spirit, it needs to have the flavor of Bupa in it, but it also needs to have its own personality. So leading that kind of environment is tricky, because you have to make sure that you're walking in and supporting that and nudging that in the right direction, rather than back to where we started really in the conversation around mandating things is not necessarily the smartest way to go. I think I feel lucky that I've been able to do this job after many years of doing lots of different leadership jobs and picking up different things in my kit bag along the way, which are serving me reasonably well. It doesn't mean I'm not still making mistakes along the way and learning things or trying things that didn't work. But the single most important thing by a country mile in this job is listening to people and listening to the front line and listening to the people who are serving our patients day in, day out, and letting them guide us in how to move the business forward.
Yeah, and that kind of pretty much touched on my next question, which was about alignment and how do you align teams and people over such a large organization. But you hit the nail on the head that it's more about listening and communication. Is there anything else that you've learned about alignment in a large organization? How do you keep all the stakeholders aligned to that central vision?
Yeah, I think it's a really good question. And again, also when you've got self-employed partners who don't work for you, we're business partners at the end of the day, but we want people to feel an affinity and a connection to what we're. I think that there's probably professional and personal ways of answering that question. From a professional perspective, and as an organization like Bupa, it is a very purposeful organization. Out for those people who are listening who don't know, Bupa's purpose is to help people live longer, healthier, happier lives and make a better world. Now, that might sound like one of those kind of purpose statements that goes in the company brochure every year or the annual accounts, but it is real. That is what we exist to do. It's very visible in the organization. So that to start off with does bind people. People feel like there's maybe something beyond just making a profit that is important to us. And there are 3 Bupa values: brave, caring, responsible. That, again, quite simple, 3 words embedded in the organization, and people try and live by that. So that helps. The other thing that we've spent a lot of time doing is just trying to show people the power of the Bupa organization and how it can support what they're doing in practice here in our head office. And we've got some quite unique assets, whether that's the insurance side of things, the healthcare expertise, we've got the data that we have, the ownership status, all of those things that help us, I think, glue the organization together. But from a personal perspective, as a leader, you learn, you go on a bit of a journey, don't you? And you build a kit bag. There are 3 words that I often talk about to my team, which I think try and guide me in decisions I make, how we think about the future. One is stewardship and around planting trees that you'll never see, building for making sure that when you eventually leave this role, whoever replaces you inherits something better than what you inherited. The second one is belonging. So creating an environment that people feel some kind of connection to, which just makes them want to be here more than just doing their job. And the third word is activism. So how do you find causes to really champion? Sometimes things that you're personally passionate about, but just as importantly, things where you see, for example, a big organization like Bupa getting in its own way sometimes and spotting it and then saying, I'm going to go and fix that. And then you build confidence from people seeing you do that. So that kind of combination, and making sure that when you put an executive team together, you're hiring people who are of a different mindset. You want lots of different perspectives, but you need people wired fundamentally that they're here to do the same sorts of things as you're trying to do. So lots of things in the mix, and I'm work in progress on that. We're work in progress on that, but we definitely feel like we're going broadly in the right direction.
How do you think patient expectations will evolve as we move through this period of technological disruption and innovation? From your perspective, what's it going to look like in the coming decade?
We can all make predictions, can't we? But sometimes you don't know what the next thing is coming around the corner. I don't think anytime soon we're going to get away from the personal human nature of dentistry. I think I saw the first filling that's been done I was in the States with it using a robot, and there are many robotic procedures being done in wider healthcare. So that's not going to be part of the future. But particularly going back to what we talked about, anxiety and healthcare, anybody who feels like they're having something done and that could be painful or whatever, you're going to need that human touch to educate people. So I don't think that's going away anytime soon. There's clearly going to be incremental benefits in lots of the tools that we're talking about. We've talked about some of the AI tools today, and people will chip away and learn and fail and change direction on all of that. But I think if you made me make one big prediction, it's that the data is going to lead us to a world of truly personalized healthcare. And whether that's just the data that people have got connecting the dots and giving you much better recommendations than you've got, or moving much more into this area around things like genomic testing. That's where I think I would suggest that we're heading. And I think dentistry can play a really important part in that. What other part of the healthcare system do people voluntarily go to on average 4 times a year for preventative checks and allow people to put their hands in and around your mouth? It's a very personal and regular touch point. So I think we have a huge opportunity to influence that. And the genomic testing does blow your brain a little bit already with what we can tell from the human genome. I've had my test mentioned, and it definitely changed my behavior immediately. Things like knowing what your risk versus average of prostate cancer are. When I found out that mine was higher than average, that motivates me to go get checked out more regularly. Whereas if I hadn't had that checked, I wouldn't know. But much simpler things as well. So that's got to be where it goes. And there's huge savings for the healthcare system in that, but also, I guess, very consistent with our purpose around longer, healthy, happier lives. That's why we're wanting to push that. So that's where I'd place my 10-year bets anyway. But I suspect it won't take 10 years. What you think is going to happen in 2035 will be here in 2029 or something like that.
Yeah, I think the personalized healthcare and the customized healthcare on genomics is really exciting. And that's going to be a big area to watch, especially around AI and data. And as things improve, it's going to be exciting. And I agree with you. I think that now the whole 10-year window is going to be shortened. It may well be, 2029 in the next 4 or 5 years. Let's see where we are. Mark, We're coming to the end of the podcast. And at the end, I always like to do a little lightning round. These are rapid fire questions to help our listeners get more an insight into your mindset and thought process. Here goes. First one is, what's one piece of technology you think will disrupt how dental care is delivered?
I think the one I'm most excited about at the moment is the note taking, and not just for the obvious practical benefit of saving time. I think that structured note taking, all of that rich data that goes way beyond what is just put in the fields on the practice management software. If we can get that as an industry structured and learn from that and build connections from that, I think that's a game changer. And we're already seeing people turn that data into video explainers of treatment types or personalized letters that can go out. I saw Microsoft talking about the ability to take those notes and ambient listening technology as well and turn it into really personalized native language, maybe for children so that they get a letter about a procedure, but it's said in the words of their favorite superhero. You could do that today. That's profound. And again, is all moving towards this thing around making healthcare just more welcoming and easier for people to embrace. So I think, note taking is where my bet is today, but ask me again in 6 months' time and maybe it'll be something different.
Yeah, note taking is one of those key pieces, and that technology is evolving very rapidly. And the second one here, Mark, one mindset or mental model that has shaped you as a leader.
I think I hinted at it a bit earlier when I was talking about personal leadership. The biggest thing that shaped me is the appreciation and understanding and then use of a personal purpose, and how you start to really benefit from being very mindful and thoughtful about how you want to go about things and how you want to be received by people. So those 3 words I use, stewardship, belonging, and activism, they are very front of mind for me in how I show up. And once you crack that, I think, and start to get comfortable with that, it does enable you to let go of a lot of things. As leaders, we've all got imposter syndrome. And if you say you haven't, I'm not sure I believe you. It's a very common thing, but the more you can get comfortable in your own skin by using personal purpose, I think you stop caring so much about that and you focus on the delivery of that. So that's probably been the biggest lever for me.
Yeah, I think that's a real key point. And people ban that imposter syndrome around a lot, but I think it really is one of those things that if you're aware of it and you can use that to your advantage, it's better than pretending it's not there. So that's really powerful. And the final one here, Mark, if you could collaborate with any innovator inside or outside healthcare, who would it be and why?
I think the coolest innovator I can think of would be, I would love to be able to borrow Apple's design team just for a few months and say, come and have a look at this dentistry business and tell me, how would you approach it? How would you come at this from a different angle? What would an Apple-led practice look like? I think that would be really exciting. And we're lucky actually at Bupa because of the number of corporate clients we have who do provide private medical insurance or whatever to their workforce. We often get access to some of these brains. Yeah, I would definitely be banging our insurance team's door down saying, can you please let me have a chat to the Apple design team? I think we'd come up with some really exciting stuff there.
Yeah, I can just imagine how amazing all the equipment will be, the hand pieces, and then that's a good one actually. I haven't heard that one before, but I think that's really original, and that would be something worth seeing. And Mark, where can people connect with you and the wider Bupa team?
So you can connect with me. You can find me on LinkedIn and I'm also on Instagram. That's been a new one for me, realizing that the dental world exists on there. But it's one of the things that's definitely been helpful in terms of connecting to the topic we're talking about today. So yeah, you can find me and the wider Bupa team. You would find us Bupa Dental Care both on LinkedIn, and Life at Bupa Dental Care is our Instagram site for people who are keen on progressing their career with us. They'd be the two best places.
Fantastic, Mark. It's been amazing having you on the podcast. Thank you for the amazing insights. And to our listeners, if you want to stay ahead of how AI and technology are transforming dentistry, subscribe, follow, and share. Join the TechDental community on your favorite platform. Your support really helps us keep delivering great, actionable insights from those at the front lines. You can reach us on www.techdental.com, email info@techdental.com, or connect with me directly on LinkedIn. I'm your host, Dr. Randeep, and this is the TechDental Podcast. Scaling a business isn't a dream, it's a decision. This is the TechDental Podcast. And if you found value today, follow, share, and subscribe. This is the edge every dental leader needs.